You mentioned opening the door, getting in the door. I think that's something that a lot of folks who are a little bit more junior at CHEST, either fellows or junior faculty, want to know a little bit more about, because guidelines, as you nicely said, are something we're particularly well known for. Talk to us a little bit about the guidelines process in just a minute or so. Like, what does it take to get a guideline proposed? How do we decide what guidelines we're going to do? And what's that process of kind of moving them through the process from getting proposed to approved to actually getting published? And I'm going to do a piece of this while we're talking.
I could mess with you while you try to do a piece and make sure you're not cheating.
I think you have to test, right? You're supposed to test and see which ones are movable.
Yeah, but if you move a bunch.
Oh, I got one. Okay, that one's good. All right. Okay. So now you have to answer.
All right. So that process has evolved over the years as well. And we put a new one in place recently that I think brings in all the best practices we've had in the past. So it's not that it's that much different. We have several what we would call our key portfolios that we really want to make sure we maintain. Antithrombotics portfolio being one of them, lung cancer guidelines, our cough guidelines have always been another really key set of guidelines for the organization. We feel that because at times the resources have been constrained, that we've ended up that sometimes those are our only guidelines are in those areas. And we really wanted to diversify the portfolio to represent all the areas that CHEST members are, interested in, involved in, and to more closely parallel our curricular pillars and the pillars that the journal have. So we are branching out into, ILD, airways disorders, critical care, sleep.
These are things currently in the workings?
That we have added to the portfolio and are now in the works, and we're doing it through two processes. One is through what we're calling sort of an RFP that we put out to the networks saying, please give us topic proposals within this pillar. And then those are really easy to do. Anyone that's involved with the network can get either whether they're on their steering committee or they can talk to the steering committee. And it's really a 2-page process saying, this is my idea, this is the gap, this is why I think we need a guideline in this area. Not a ton of work. Those initial 2-pagers get reviewed, and then several are asked to submit a little bit more fleshed out proposal. Who would the chairs be? That could be the person proposing it. Who would be on the panel? And with some guidance from the committee on how to create a panel, what kind of diversity we need there, what the questions would be, what clinical questions are you answering, and eventually we will pick one of those in each area for each year. But in terms of getting involved, it would be they can propose one of these, they can work within their networks to say, if we have a topic accepted, I would like to be one of the panel members. So learning how to be on the panel, I think those would be some easy first steps to get involved. They could also try to, be involved with the Guidelines Oversight Committee itself when there are openings through the regular nomination process, because many of our GOC members don't necessarily have experience on a panel yet. That's not a prerequisite.